All right. Well, I'm really excited about today's conversation. Mental Health Awareness Month is something that's very important to me. I believe that mental health is a topic that is not talked about enough. And my guest today, Andy Riggs, has been in radio for over 20 years. He's made several TV appearances. He's the host of Riggs Off the Radio podcast, the board co-chair of the American Foundation for Suicide Prevention Wisconsin chapter. And he's also, during the month of May, hosting these mindful minutes on different social media platforms. So Andy, thank you for being available today to talk about this important topic. So I just kind of want to get right into, when did your passion for mental health begin?
I think honestly it was right after I lost my uncle to suicide in July of 2017. I kind of knew about mental health before then, but I really started looking more into it after that happened, because if you look at some of the people that have died by suicide in the past, you think of like Robin Williams, you think of some of the famous celebrities that are very happy and outgoing, a lot of comedians and actors and actresses who seem to be very okay on the outside, but there's a lot going on the inside. And the big thing about mental health is, while it's linked to physical health, unlike like a broken arm or a broken leg, you can see that, but you can't see when something's wrong in someone's brain. So that's kind of when it started. After I lost my uncle, I sought out an Out of the Darkness walk that we do with AFSP, the American Foundation for Suicide Prevention. I found the local walk here in Milwaukee, and I decided I wanted to get involved with that cause. And since then, I unfortunately also ended up losing 2 other friends to suicide as well. So it kind of reinforced my mission in working with suicide prevention and mental health in general. And the more I talked about it, the more I realized that it needed to be talked about more. There was a thirst for people to not feel alone, that they were, people to be heard. People need to be heard.
While listening to some of your podcasts, almost like a humorous way of kind of approaching the mental health topic, so it's not so serious and so black and white. So what type of reaction are you getting from other people when you are opening up about mental health, or maybe your experiences and things like that? How are people responding? Are people more like closed off and saying, well, that's mental health, that's a taboo subject, we're not going to go there? Or what does it look like?
It's actually quite the opposite. It's been pretty embraced very openly by our listeners. More like what I talked about my uncle's suicide on a radio show on KISS FM. I got a lot of calls about people saying, I'm glad that you said this. I also lost a father to suicide. I lost a brother to suicide. It impacts a lot of people, and there's a lot of stigma and shame around suicide. Even at my uncle's funeral, there were 3 different excuses as to how he died. There was a car accident, a heart issue, and just a sudden death. Nobody would come to terms with the fact that it was a suicide. And me seeing that in my family, I realized that there's a lot of shame around it, because it used to be a crime back in the day, and there was a lot of shame behind suicide. People think that people that take their lives are weak-minded. They're taking the stigma as a coward's way out, which I just hate hearing that, because there's always so many underlying issues with a suicide. There's more often than not, there's a lot of undiagnosed mental health conditions out there. So it impacts more people than I thought. And the ripple effect behind a suicide, I also realized is very huge, because you've got friends and relatives and family members with so many unanswered questions. So I've always gotten a very good positive response, and even more so when I started talking about my own struggles in the last probably 3 or 4 weeks. My anxiety and depression have started to kind of creep up a little bit more on me with the isolation of being in quarantine and just the uncertainty that we have in life right now. So me opening up about that, I've had people reach out saying, "You have mental health struggles too? I didn't know that." And I'm not perfect. I'm very mindful of my own emotions. I've always been mindful of my depression and my anxiety. And when they're creeping up, I know not to let them get the best of me. I start talking about it. I see my therapist. I talk to my wife. I play my guitar. I listen to music. I read a book. I go for a run. I exercise. So I take care of myself, and I make sure I nip it in the bud so it doesn't become a bigger issue.
Yeah. John Kabat-Zinn, he's the founder of the Center for Mindfulness at the University of Massachusetts Medical School, and he defines mindfulness as being awake and knowing what you're doing. Now, when I read that, I felt that, wow, that just sounds so simple, but why does it seem so hard to be mindful?
I think of mindfulness as like street smarts for the brain. It's like being aware of what's going on and not just brushing it aside as just a bad day, realizing that it might be more than just a bad day. If you're not getting out of bed, if you're withdrawing from hanging out with your friends, or even reaching out and talking to your friends more than normal, being aware of what's going on in your head and what's causing you to feel a certain way. Why am I constantly anxious? Why am I not sleeping tonight? And knowing, well, this could be anxiety. I think mindfulness is awareness without panic, is another way I would say it. Just being very aware, but not overly panicked. Kind of like we need to be about the coronavirus. I don't think panic is necessary. I think panic just creates more panic, and it can cause you to worry about the things you can't control. But being mindful about the things you can control are very important. So mindfulness, I think it's easy, but I think people overcomplicate it because you think you have to be like a enlightened Buddhist monk to be mindful when
That's exactly what I was going to say. I feel like you
right.
have to be like someone who has letters behind your name and all these things, and you've had some spiritual awakening. So it's so simple, and we make it so difficult.
I think there's a degree of honesty as well with and personal accountability with mindfulness as well. Not brushing it off as just nothing and knowing that it could be anxiety, but it's not the end of the world.
So, what would you recommend for someone who maybe is just like, I just don't know, but I'm just anxious right now. I don't know where it's coming from, but I want to handle it. I don't want to just lay in bed all day and be depressed.
I think we're all grieving. I think we're grieving our old way of life. We're grieving not being able to go to baseball games. We're grieving not being able to hang out with our friends, our family, hug our loved ones. If someone's in the hospital, we're used to going and comforting them and being around them. If someone loses their job, we're used to going out and having drinks and comforting them. But all that is gone. And everybody's grieving right now. And I think it's okay to allow yourself to go through that grieving process and not worry about, well, somebody probably has it better, much worse off than I do. And that may very well may be the case, but everybody grieves differently and everybody's entitled to their feelings. And well, we may be entitled as Americans to do whatever we want. The fact that we can't do whatever we want right now is kind of shocking. So we have to, at least for the time being, grieve our old way of life. And I think that can be done internally on your own, knowing that it's okay to feel not okay. It's okay to be sad sometimes. And it's also okay for other people to, grieve not being able to get a haircut, not being able to do the things that they want to do, go to a restaurant, the things that we can't do anymore. It'll all come back. It'll be different, but we all have to grieve, and everybody grieves at different speeds, and everybody grieves in their own way.
Yeah. And you are doing these mindful minutes on Instagram, Facebook, and so there's obviously a lot of different mental health topics, struggles, and things that we're dealing with. So you're handling like a different topic or idea every single day throughout this month. What are some of the topics that you've covered already and will cover the rest of this month in those mindful minutes?
Some of the ones that I've covered so far are, basic things like the National Suicide Prevention Lifeline number, the fact that it's okay to not be okay and to be depressed every once in a while, as long as you're aware of it and you're talking out your feelings. Positive coping mechanisms. I play guitar sometimes, or dancing, exercise, and as well as other mental illnesses that aren't really talked about, like eating disorders or bipolar disorders. Things like that people don't really think about as mental illness. Eating disorders are a huge mental illness that people don't even think about. So that might be one of the topics. The mindful minute is a way for me to reach out to people in a brief amount of time. It's a minute. I think everybody can spare 60 seconds.
Mm-hmm.
And just little bursts of information and tips that people can use. And if they can use them, great.
Awesome. And in one of the podcasts that you had, your most recent one, you had mentioned about when the coronavirus pandemic is done, you said that a mental health pandemic is next. So what does a mental health pandemic look like? I know you've kind of talked about some of the things that we're already struggling with and how we're grieving and things like that, but how do we recognize when we need to address some things that are in our mental health? And how do we move beyond, and how do we get
Well, I don't think we need to be terrified of a pandemic because I think talking about a mental health pandemic is something that we can see coming and kind of predict. And I think even if we could have predicted coronavirus, it could have been a little bit easier. We could have eased, going into that. So I think knowing now that we're in such a crazy place and I hate to use that word crazy, an uncertain place rather. Um, we are all grieving. We're all going through the same thing right now. Everybody is impacted by this. Even if you're still going to work every day as an essential worker, healthcare workers, everybody is going to go through something and we're all experiencing a degree of trauma. So I think accepting it and being mindful, like we talked earlier about it, mindful of the fact that we might be going through a lot of anxiety right now and being able to talk about that with our friends and our family, even professionals. I mean, we can't see therapists face to face, but there are so many resources virtually. There's BetterHelp, there's Talkspace. There are a couple of apps, just to name a few that I've heard of, where you can have virtual therapy sessions. A lot of therapists are offering telephone services, teleconference services. So getting in on that ahead of time and knowing now and being very aware. And like we said earlier, we talked about mindfulness and being aware of your feelings now, not shoving them down deep below. Like men are really good at doing that. Men are good at just brushing it off and using I'm fine. And I hate the word fine because fine doesn't mean fine. Fine, I say, stands for freaked out, insecure, neurotic, and emotional. That's what fine stands for. So which one of those four are you? Because you're not really fine. So I think the more that we are personally and emotionally accountable during this time and we're taking care of ourselves and we're talking about our feelings and we're reaching out to our friends, especially if friends that are, extroverts right now because they're hurting, because they want to go out, they want to party, they want to hang out with friends and they can't.
Yeah. Before we go, I just wanted to also mention two other resources that I think are really important. We talked a lot about suicide, and I think that, again, that's an under talked about topic, and we could go on for hours just talking about that and how the stigma with that needs to go away. But suicide ideation is a serious thing, and so there is the 24-hour lifeline that's available at 1-800-273-8255. And then there's also the crisis text line where anyone in any sort of a crisis can text home to 741-741. I think those are really important things. And then, of course, there's the AFSP website where you guys have different resources available there and can connect people to different things as well.
I think it's important to know that suicide prevention lifeline, it doesn't have to be just if you're in a desperate situation and you're suicidal. It is for those people, but it's also for maybe you have a friend that you're worried about and you don't know how to talk to them. You're not a mental health professional. You're not sure if you're going to say the right thing or the wrong thing or sway them in one direction. And if you're concerned about someone and you genuinely want to reach out to them, you can call the National Suicide Prevention Lifeline and ask them, hey, I've got a friend in crisis this is what they've been doing. This is how they've been acting. Tell them, get point blank with the person on the phone and they can give you some advice. You could also call the lifeline with the other person in the room. I've heard of people doing that before. And there's four call centers in Wisconsin right now that are used, and it gets used quite a bit. So it doesn't just have to be if you are yourself are in crisis. It can also be used as a tool or a resource. The first thing I said, especially during this pandemic, because it's such an uneasy time, number one is to stay active mentally and physically. Doing things with your brain, if it's playing video games, if it's reading books, if it's doing puzzles, if it's drawing, something to keep your brain active. And physical activity is important. And you don't have to go and swing around weights or do CrossFit classes. You don't have to do Taibo, but standing up and moving around, going for a walk, just getting your body moving is so crucial to, positive mental health. So staying active mentally and physically would be number one. Number two is to focus on the things you can control directly. You personally can control. That's your diet, that's your exercise, that's your intake of news and social media, your own personal hygiene, things that you can control. Obsessing over the Karen at the grocery store who isn't wearing a mask and getting angry at somebody doesn't do any good for you. That causes a bunch of undue stress on yourself. It's nothing you can control. You can do the best that you can on your own, but worrying about the things that you personally can control is crucial. Number three is to stay connected. Reach out to people. If you're feeling upset, if you're feeling alone, you're feeling concerned about anything, reaching out, staying connected, and reaching out to other people as well that you might be concerned about, even just to say hello. It doesn't have to be a deep, dark conversation about, mental health or anxiety. It can just be a nice conversation. Sometimes just reaching out to somebody and saying hello and asking them how they're doing can go very far. Reaching out for help when you really need it and being able to recognize that and talking to a therapist or calling the suicide prevention lifeline or having a real serious conversation. And the other one is just to be kind. Be kind to yourself. Be kind to others. It sounds so cliche and so corny. Be kind and be nice, but it goes so far. I mean, it really does. I mean, I was in Menards earlier today. Everybody's wearing face masks, and it was a weird situation, but just saying hi to people as you're walking by and not acting like they have the plague and they're going to cough on you and kill you. I mean,
Right.
it's not that bad. You can still be kind to one another and, wave and say hello. Kindness goes so far, and we're so divided as a country in a lot of ways, politically and on the virus and everything. I think being kind to one another can go far. So stay active mentally and physically. Focus on what you can control. Stay connected with people. Reach out to people and be kind. Those would be my 5 tips.